Julie, okay, so welcome do we want to start recording? Oh, you did start recording. Thank you. So you welcome everyone to our annual poster presentation. I think it's about the third or fourth year online. So really excited to have some amazing presenters today, students and faculty. And just wanted to give a shout out for the abstract review. When you submitted, we had 4 reviewers. So just wanted to thank Dr. Margot Latimer, Dr. Janet Curran, Dr. Rebecca Afu, and Dr. Christine Cassidy. So those have been scored by those judges. And the judges today are Lindsay Van Dam, PhD student, and Dr. Sherry Price, who will be joining us at 12:30, and myself, Dr. Megan Aston. And you will see there's just 2 judges per presentation. So there'll be 5 minutes about to do your presentation, and then the judges will ask questions. And then if there's any time, the audience can ask some questions. Again, it's 10 minutes, so it's pretty quick, so not too much time there. So Julie, thank you. Julie Berry, a research manager, will be helping to keep us on track, and Julie has organized this session for us. So thank you very much, Julie. Any other housekeeping things that we need to say, Julie, before we get rolling?
No, just so that everyone knows who's joining that it is being recorded and it'll be on our website. So just to give you that. And I can turn over to the first poster if Erin's ready.
Yep.
Okay. Can everybody?
We don't see it yet.
Oh. What? Hang on. Can you see it now?
Yes, we can.
Oh, sugar.
Just need to back it up. Yeah, perfect.
There we go.
Perfect. Thanks, Julie. So my name is Erin, and I'm finishing my first year of the PhD in nursing program. My primary research interests are in implementation science and kidney care, so I'm excited to be presenting my proposed scoping review on implementation strategies for evidence-based interventions in renal transplantation care. The period of renal transplantation presents a lot of challenges for transplant recipients and their families as they adjust to this new life requiring new medications, new self-management strategies. There are a lot of increased risk of complications related to their new graft. And there's also been evidence to practice gaps which have been identified in the kidney care setting. So I might just pause here just to kind of define what I mean by implementation interventions and implementation strategies. So an implementation intervention is what we're trying to move into practice. So for example, an intervention could be like an influenza vaccine, for example. And then the implementation strategies are what we use to support this implementation, adoption, and sustainability into practice. So things like education, audit and feedback, financial strategies, things like that that kind of help support the implementation. So from this, we can kind of see the emerging gap as we have a lack of understanding as to which implementation strategies are used in renal care, and we need a better understanding of which strategies are most appropriate for different contexts. So going from that, my primary research question is what implementation strategies are used to implement evidence-based interventions in post-renal transplantation care? And then I have a few sub-questions related to implementation science. So what theories, models, and frameworks were used? How were knowledge users engaged? Specifically, what strategies have been used for adoption, sustainability, and de-implementation? Also, it's really important to understand what the barriers and facilitators are to actually know what strategies are appropriate appropriate. And then we'll be looking at the alignment between what these barriers and facilitators are, and then the strategies that have been selected. And then finally, we'll also look at the implementation process and outcome measures. So following a JBI methodology for scoping reviews for this project, we use the PCC acronym. So focusing on renal transplantation recipients and healthcare providers in this population, looking specifically at strategies to facilitate the adoption, implementation, sustainability, or de-implementation. And then it'll be pretty general for the context. So really any inpatient or outpatient setting with this population. For methods, just consistent with the JBI scoping review. So we'll start with the title and abstract screening, moving to the full text with 2 independent reviewers for both of those stages, and then have a third reviewer in discussion to resolve any conflicts that may arise. Then moving to data extraction with 2 separate extractors, same process for any conflicts, and we'll be using a data extraction tool for that. Then finally moving to the data analysis, which I think I'm most excited about because it uses a few different implementation frameworks. So starting, we will code the implementation strategies that we identify to the ERIC recommendations for implementing change taxonomy. So they have 9 clusters of different kind of areas of implementation strategies. And then we will be then coding the identified barriers and facilitators to the CFIR, which looks at contextual determinants. Then from there, there's a mapping tool that actually looks at the barriers and sees what strategies are actually most appropriate for those barriers, the CFIR ERIC mapping tool. And then our final piece is to code the outcomes for implementation research as well. So our outcomes for this project is to hopefully provide some insight to clinicians who are looking to support implementation projects. Also, of course, uncovering evidence-based gaps in implementation, and finally also looking to document the use of this new CFIR ERIC mapping tool and adding to the evidence on determinant strategy mapping. Thanks.
Awesome. Thank you so much. Lindsay, I'm going to turn it over to you if you'd like to ask some questions.
Sure. Thank you, Erin. I love your poster colors here too. Very, very nice. My question for you was actually what led you to determine that a scoping review was prudent or most appropriate for this topic?
Yeah. So just where there's not a great understanding of this area, I wanted to be a pretty broad review looking at it, just looking at it through a systematic like quant or qual review just didn't really seem appropriate. Where we're really trying to map and characterize the evidence that's out there.
Excellent. Thank you. Maybe I'll throw it to Megan next.
Yeah, just to build on that, I was going to ask a similar question. Why did you choose scoping and not systematic? Like they're both super rigorous, so why did you choose scoping and not systematic?
I think like kind of for that reason, just where we wanted it to be a bit more broad. My understanding of a systematic review is it is a little bit more focused with the review. So I know that the scoping review doesn't necessarily require to evaluate the evidence in the same way, but I think kind of what's important with this one is just to really kind of get an understanding of what's out there in the literature, which is why the scoping review is selected.
Yeah, no, and that's really helpful, and especially people who haven't done JBI or anything, it's very helpful for that. And just to follow up can you explain a little bit more about the mapping and the barriers? I didn't quite understand that.
Yeah, absolutely. So So in the review, we'll be kind of extracting any information where the papers will be discussing what barriers they've identified in their practice. It's possible that some papers won't identify barriers. They'll just kind of select strategies without doing any sort of assessment, but we know kind of the best way to select appropriate strategies is to have an understanding of the context. So in the papers that do discuss the barriers, we'll then be able to kind of code them or map them to different areas of the CFIR. So the CFIR is a implementation framework similar to like the theoretical domains framework or COMBI model. If that's more familiar. So there's different categories. And it also actually the newest version of the CFIR maps with the TDF as well. So so we'll have those different sections. And then from there, there's this relatively new CFIR ERIC mapping tool where you can kind of input your barriers and or the area that they fall within. And then the mapping tool, it's an Excel document that was kind of created by experts. And then that kind of spits out what's the most appropriate strategy. So then we can look at the alignment between what's actually suggested and then what's actually being used in practice.
Okay, right. So CFIR is connected to the implementation.
Mm-hmm.
And why are you choosing barriers? And are there any other things you're looking at?
So barriers, so looking at the barriers and facilitators just to really understand the implementation process. So why, so a lot of the times, if we're not looking at the actual context when we're trying to implement interventions, it's unclear why the implementation process is successful or unsuccessful. And just having this understanding of what actually helps move something into practice or what's actually hindering moving something into practice will help us to better move through the implementation process and make the actual implementation more successful, hopefully. So that's kind of the rationale for looking at the barriers. And then some of the other pieces is just there's a lot of different implementation theories, models, and frameworks that are evidence-based, commonly used, but not as often as they should be. So interested to see kind of if researchers are applying those. And the strategies piece, I think I already discussed there. So
Yeah. Just curious why, there was a particular focus at barriers, but then I also heard you say facilitators, but
yes. Yeah. Oh,
okay.
sorry. So the barriers piece, the mapping tool actually doesn't have facilitators in it yet. That's kind of one of the limitations, I suppose. Yes,
Okay.
but I think it's important to kind of look at both. I think that's more helpful, even though the tool doesn't support that yet. Maybe it will in the future, but then it'll kind of give us a better understanding. It's definitely more like strength-based approach, I think, in a way, looking at that too.
Awesome. Quick question from the audience.
Yeah,
Oh, Dami, go ahead.
Hi, Erin. Great presentation. Thank you for sharing your work. First question before then my comment. Like kind of relating back to Lindsay's comment about if and Megan's comment about if a scoping review is really an appropriate method for this. Have you heard about realist reviews?
A little bit. It's not
Okay.
definitely not an area I would say I'm an expert in though.
Okay, so because as I'm looking at all your questions, like, both theories, you're interested in knowledge users, you're interested in strategies, barriers, and facilitators, it looks to me more like a realist review, which really looks at context of an intervention, the mechanisms by which, the interventions are implemented and the outcomes. So you might probably want to check that out and see if it aligns better than, a scoping review method. I think you're gonna lose out some great opportunities in terms of really conducting a review that will, inform practice in the future. Like what you're planning to do is much more than mapping. Like you're looking into other things, right? And the realist review will probably be more appropriate for you.
All right. Well, thank you so much for your presentation and questions from everyone. And we will move on to our next presenter.
Sorry, I think I've gone out of order. Just gonna play. Oh, there you go. Sorry, I got the order wrong. So Timmy is number 2.
Hi, and hopefully it's bigger on your screen because it seems very tiny on my end, but that's okay. Hi, everyone. My name is Timmy Idris, and I am a first year is over. So I'm going into my second year of the PhD in health program at Dalhousie University. And my research is on the well-being of Black women that work in nonprofit organizations. So, charitable organizations have always played a crucial role in society. They provide essential services like food, shelter, and education. And during the COVID-19 pandemic, the importance of nonprofit became even more evident as they were tasked with providing increased support to their communities. However, the experiences of key contributors to the sector, particularly those from minority groups who are the employees, are often poorly misunderstood. My research aims to shed the light on the experiences of Black women in the nonprofit sector. Black women face unique challenges rooted in systemic inequities. In nonprofits, employees often encounter low wages, limited benefits, and job insecurity. These issues are exacerbated by societal attitudes that undervalue their work and expect them to overperform without fair compensation. This leads to chronic stress and burnout, further impacting their health and well-being. For Black women, their well-being is put at even more risk due to Black fatigue. Mary Frances Winter coined this term and defines it as extreme exhaustion that is linked to mental and physical maladies that are passed from generation to generation, which is an impact of anti-Black racism. The exploitation of Black women's labor is rooted in misogyny, an intersectional construct that characterizes a distinct form of anti-Black racism. Black women experience this through stereotypes, violence, a lack of regard for bodily integrity, and enduring physical and emotional distress. This phenomenon underscores the use of stereotypical notions and tropes that dehumanize and diminish the worth, bodies, value, or capability of Black women. Two-dimensional depictions and reductive ideologies deny Black women the full spectrum of human emotions, suffering, and pain, contributing to their dehumanization. There's a passion for nonprofit works that drives most nonprofit employees, which stems from the sector's values and the cause it represents. They're very close to it and they want to give back, they want to support their communities, and they just want to help, basically. And the nonprofit sector has a direct impact on people's lives and social justice, and staff members tend to overwork themselves. The global pandemic and the focus on anti-Black racism sparked by the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, and so many others put even more risk on people of color that work in nonprofit, especially Black women. As requests for them to educate staff and take up equity, diversity, inclusion, and accessibility work increase without regard to the unpaid physical and emotional labor that goes into it. To understand these challenges, I aim to employ critical race theory and intersectionality. These frameworks highlight how race and gender intersect to create overlapping oppressions. Examining nonprofit work environments through this lens would reveal systemic barriers to wellness and calls for more inclusive and equitable practices. While thinking of nonprofit organizations, the common perception is that they're dedicated to social good, community services, or advocating for equity against unjust systems. While not all nonprofits follow the same strategies, the majority would claim a commitment against racism. However, systemic racism can still permeate these mission-driven organizations, manifested in hiring and promotion practices, community engagement, internal and external communication against challenges observed in the corporate sector. In Canada, nearly 1 in 3 Black women is employed in health and social services, surpassing other groups of women workers. These roles are demanding and exhausting. And understanding race and gender dynamics also informs program design and service delivery. Tailoring initiatives to address the specific needs of diverse groups enhances the effectiveness of services and ensures that they're culturally competent. Inclusive workplace cultures are also vital for the well-being and satisfaction of employees. Addressing issues related to discrimination and bias can significantly improve morale, retention, and job satisfaction among Black women in nonprofits. Exploring these dynamics builds trust within the communities that nonprofits serve. It also shows the commitments to understanding and addressing the unique challenges faced by different demographic groups and fostering more effective community engagement and collaboration. In conclusion, examining race and gender in the nonprofit sector is essential for promoting equity and justice. By addressing systemic issues and enhancing inclusivity, nonprofits can better reflect the values of the communities. Black women face a distinct set of challenges, and addressing these challenges is not just about improving individual well being, but also about enhancing organizational effectiveness and community impact. It's imperative that we work towards eliminating racialized inequities and ensuring that Black women are treated equitably within the sector. Thank you very much.
Wonderful. Thank you so
Thank you,
much.
Timmy.
Lindsay, do you want to start?
Yeah, I'd love to. Thank
Great.
you, Timmy, for your presentation. I have two questions for you. My first one is I'm wondering if you have determined a certain sector of nonprofit that you're intending to look at amongst your participants, or if it's broadly, or if it's those that are working in the healthcare sector. And then I'll just add in my second one. Maybe you can go in that direction next. My second one is if you could just expand on what qualitative methodology that you're planning to use.
Okay, thank you so much, Lindsay. So no, I'm not sure yet what field I'm looking at. I'm still like trying to figure out if I want to limit it to a particular field of nonprofit or if I'm gonna go big or go home. So still working on that, and with the help of my supervisor, just trying to. It's a PhD thesis, so also not trying to do too much. Um, and to your second question, I hope to be interviewing 20 Black women that work in nonprofit, and I'm hoping to do in-depth interviews. But now I say that I did not include that there. After the in-depth interviews, I'm also hoping to do focus group discussions with all the 20 Black women, hoping that some of the themes that we saw during the in-depth interviews will be able to like expand on them during the focus groups, and also using thematic analysis to analyze the data.
Excellent. That provides much more kind of clarity around that. Thank you.
Great. Yeah, I'll just ask one question and then pass it on to the audience. So yeah, great literature review. Obviously, you've supported the reason why you're doing it, but I'm just wondering personally what brought you to want to do this research?
I worked in nonprofit.
Oh, okay. So yeah, some personal, because we often talk about the positionality of the
Yeah.
researcher, and
Mhm.
I don't know if you've written about that or thought
Yes.
about you as the researcher, how you will engage with
Yes.
participants. Do you have some thoughts?
So
Yeah.
yes, thank you so much, Megan. That's an important part of this research because yes, as I said, I worked in nonprofit, so I kind of have an insider position in the research, and I think that is useful. But also ensuring that in the research process, I'm being reflective about my status as a power holder in the research too, making sure that I am using the support of my committee members to just try to like look at that data because sometimes I might be too close to it. But I definitely think the specific and unique lens that I bring is also very useful in understanding some of those nuances.
Yeah, awesome. We have still quite a bit of time, 2.5 minutes. So please ask some questions from the audience or comments.
They understand everything. Okay, Keisha.
Yep, there we go. Go, Keisha.
I have a question. A wonderful presentation, Timmy. Very excited for this work. I do have a question just around your theoretical framework and very curious. So I see that you are using intersectionality, which is grounded in Kimberly Crenshaw's work, as well as critical race theory. So I'm very curious about the pairing of intersectionality with critical race theory. So maybe if you could speak to your rationale for selecting that.
Okay, I wouldn't say it's appearing. I would say like for now, those are the two theories that I'm looking at. And I think like I also feel like when I do the research, when I do the interviews, and just going through that process, the best theory to work with would come out of it, if that makes sense, in the sense that I'm still like in my first year, so I haven't started doing the research, so I'm still trying to figure it out and figure out the framework that would best fit. Is that what I'm saying? Yes. So kind of like a grounded theory where the data would kind of lead you into the theory. Does that make sense?
It does. So are you then saying that grounded theory would then be, say, a theoretical framework or a methodology that you're also using to inform the
Yeah,
work?
I'm just
Yeah.
like at this point, I'm just doing a lot of reading and a lot of literature review to kind of like see and expand, broaden my horizons as to the theories, especially theories of Black feminist stuff and things like that, and say like the best path to follow. Yeah.
Amazing. Thank you.
Welcome.
Awesome. Did we have one other hand up I saw or oh, okay. Yep. Quick question. Go ahead.
If we have time. Mine's very easy. I just wanted to know how your first year went now that it's over.
Oh, thank you. Thank you. It went great, actually. It went really great. Hoping to start work on my comps. And Dr. Jeffries is on my committee. So this is the first time she's really hearing me talk about my work. So yeah, I'm really excited for going into comps.
Oh, excellent.
Wonderful.
Wonderful presentation, and you're in great support with Dr. Jeffries.
Thank you so much.
We
Fantastic.
put you in the hot seat then there, Timmy.
Yeah, she's like, I'm gonna quiz her. But it's all good.
Thank you so much. Wonderful. And Dr. Sherry Price has joined us. It's perfect timing. So yes, we've just finished our second presentation and we are on to the third. Yeah, because I know that Sherry and Lindsay will be the judges for the next. Okay, go. Yeah, Julie, we will take our
yes.
cue from you.
Give me a second here. No, I'm going to go backwards, aren't I? Oh, there you go. So yes, it's Neda.
Great. Okay,
Okay.
turn it over to you, Nada, and whenever you start, we'll kind of openly start.
Can you hear me? Can you hear me?
Yes.
I have to keep the camera off. Hello, everybody. Thank you for the opportunity that I can present my paper poster titled The Importance of Reflexivity in Qualitative Research. I'm a second year PhD student at Dalhousie University. As you know, qualitative investigators are encouraged to do because appropriate decision regarding all phases of the research study depends on the investigator's reflexivity. Reflexivity can provide a comprehensive description of the research process. It focuses on subjectivity and positionality of investigators in the research study. Subjectivity highlights how investigators' identities such as gender, race, or other identities influence their understanding of the world around them. Positionality is also important in qualitative research studies. When investigators start the research process, they would like to learn about a topic. In the beginning, the investigators choose to study a topic based on what is considered relevant or appropriate to them and the field of study in a specific time and culture. This decision regarding the topic is made based on what is acceptable personally, professionally, or culturally. So there is a bias type of knowledge in the beginning. Let's start from topic. For example, questions like, why do I choose this topic? Why am I in the best place to answer the research questions? Gender or culture or academic background this topic and forming research for all research phases. Choose a specific special way, do not choose methods. Quality of researchers are members of community and study, and outsiders are considered external to the community. Both being insider and outsider have some advantages and disadvantages. It can help have different observations. Investigators are encouraged position. Warn about the risk of these binary perspectives, means inside outside, is not completely being an outsider of a research study. A feminist point of the body is about not examining it, debriefing and critical self-reflection. For example, fill notes and memos to collect thoughts, personal feelings, and overall and how knowledge is produced, role that investigators play. Thank you very much for listening.
Thank you, Neda. I have a question. Is this the topic of your PhD dissertation?
Can you hear me?
We can't hear you very well, no. Can you hear us?
Yes. Sorry, Neda, we could only hear about half of your presentation, and I know you've been having difficulties connecting from Iran today.
A conference.
Yeah, just try to answer the question. Hopefully some of it will come through. Oh dear.
I keep camera off. Can you hear me right?
Not really. It's kind of half and half. Yeah, just try talking. Yeah, I don't think it's working. Oh, this is very unfortunate. So sorry, Neda. We saw your beautiful poster. We have read it. We probably heard about half of what you were saying. So unfortunately, with the technical difficulties, we'll just kind of have to go with that. Go ahead, Lindsay. Any further discussion? Go ahead.
Yeah, I'll just add that it's clear that you've really done an extensive review of the literature here, so I commend you for that. Definitely. I know we're having some audio issues, and perhaps you could put it in the chat just so that we could like type it out there so we could know. My question for you was just clarifying what your research questions were, what the aim of your study was on this topic.
To be honest, can you hear me?
It's cutting out quite a bit.
I didn't know that anything about the reflexivity. Yeah. And make my understanding greater about the more about the reflexivity, what is reflexivity, what is subjectivity and positionality, and they research study. They are my aim from this research study. Can you hear me?
Great. Thank you,
No?
Neda. Yes, I can.
Yeah. Thank you.
Oh, and now we cannot hear anything.
I don't know that anyone's speaking.
Oh, I thought Nada was trying to speak.
Oh,
Okay.
okay. I didn't see a
Yeah.
circle in either.
Right. Are you trying to speak, Nada?
I completed my explanations.
Okay.
I can go ahead and ask a question.
Thank
since
you,
we-
Noah. Go ahead.
So I see that this is part of your comprehensive exam. So kind of looking at answering those bigger questions going to inform your work moving forward. But what kind of research idea is emerging from this? Like what kind of study are you going to complete or project that's going to inform your PhD work?
For my PhD dissertation, I'm going to work about the postpartum Persian mother experiences during the period.
We keep seeing the little purple circle and just can't hear you. Great. Okay, well, sorry about the technical difficulties that we're having across the globe. Heard part of it, and I guess we'll just have to go with that. Thank you so much, Nada, for your presentation and the questions from the judges and Noah. Thank you. Okay, Julie, we can move on to our next presenter.
Great. So, oh, hang on. So Noah, take it away.
Can you hear me? I just wanted to make sure I'm set up at work, so I don't always trust the VG hospital for good internet.
Yes,
can hear you.
yes, we can hear you.
Yes.
Excellent. All right, so my name is Noah Doucette, and I'm excited to present our study titled Clinicians' Delivery of Human Papillomavirus Prevention to Men, an Exploratory Study. I'd like to also recognize Research Nova Scotia's generous contributions in awarding this project one of the undergraduate Scotia Scholar Awards. So a little bit of background on the topic. The human papillomavirus, commonly referred to as HPV, is the most prevalent sexually transmitted infection and is responsible for more than 5% of all diagnosed cancers worldwide. Vaccination remains the gold standard for HPV prevention. However, vaccine uptake remains a complex issue. In Canada, the National Advisory Committee on Immunization recommends vaccination for all men and women between 9 and 26 years of age, but can be administered until the age of 45. Currently, according to the most recent evidence, approximately 56% of the general population reported being vaccinated against HPV in 2017, compared to only 11% in men. The stark contrast in rates of HPV vaccine uptake amongst men suggests an urgency in addressing this urgent population health concern. Evidence suggests that clinicians' recommendation of a vaccination is a significant predictor of successful vaccine uptake, but are found to be hesitant in recommending HPV vaccines, particularly to men. Clinicians are reported to have outdated ideologies about HPV being predominantly a women's health concern, which further contributes to the marginalization of men. So now taking you into this current study, the guiding research question for this study was how are clinicians providing HPV prevention to men in Nova Scotia, Canada? The objectives of the study were to 1, explore clinicians' delivery of HPV vaccination to men, and 2, to understand clinicians' knowledge, attitudes, and frequency of delivering HPV prevention to men in Nova Scotia. Eligible participants for this study included clinicians with an active license to practice in the province of Nova Scotia, and participants could include physicians, nurse practitioners, registered nurses, and pharmacists. I'd like to point out a limitation of this study is that we did not include oral health professionals, which are important clinicians to involve due to the prevalence of HPV-related oropharyngeal cancers. So now for the methods. This exploratory cross-sectional survey study employed purposive and snowball sampling to recruit clinicians across the province of Nova Scotia. The survey instrument was created by the research team and consisted of 12 questions specific to demographic characteristics, knowledge-related questions, attitude-related questions, and frequency-related questions. Finally, data analysis involved chi-squared, binomial tests, and frequency distributions. Now I'm going to take you through some of our key findings. So a total of 30 clinicians were recruited to participate in this study. Participants included physicians in primary care, physicians in specialty practice settings, nurse practitioners, pharmacists, and registered nurses. Furthermore, more than half of the participants were female and between 30 to 39 years of age, which may implicate the findings presented below. The key findings were uniquely categorized to present clinicians' knowledge, attitudes, and frequency of delivering HPV prevention to men. Firstly, clinicians' knowledge about HPV in men was notably quite high. 83% of participants correctly identified the current HPV vaccine recommendation, and 76% identified cervical cancer as the most prevalent HPV-related malignancy, both of which were statistically significant. Secondly, attitudes about HPV vaccination in men were predominantly positive. 96% of participants agreed with the inclusion of men in HPV vaccination efforts. 83% of clinicians reported a willingness to adopt the current HPV vaccine recommendations into their professional practice, and 60% directed conversation about HPV vaccination equally to both men and women, all of which were once again statistically significant. Finally, the frequency of delivering HPV prevention to men revealed a concerning gap in preventative practice. 90% of clinicians reported engaging in discussion about HPV vaccination with men less than 5 times per week, and 53% of participants reported administering the vaccination to men less than 5 times per month, both once again being statistically significant. Now, to wrap all this together, I'm going to leave you with a few closing remarks. Women are not the only high-risk population warranting HPV prevention. This exploratory study found that clinicians' knowledge and attitudes about HPV vaccination were relatively high. However, their infrequent delivery of conversation about HPV vaccination and administration of the HPV vaccine to men revealed a concerning gap in preventative practice. Future research must begin to explore the factors impeding clinicians' delivery of HPV prevention to men in order to optimize preventative practice at the public health level. Thank you.
Thank you, Noah. Thank you for your presentation. I have a couple of questions. In regards to the frequency, do you know the frequency of these conversations that they have with women?
So a lot of the research has been done with women, and one of the emerging themes that came from that was that because of the presence of birth control in a lot of these younger age teenage girls and young women, they have more opportunities to present the option to be vaccinated outside of the school setting, where currently in Nova Scotia and Canada more broadly, vaccination is offered in school-based settings from grade 9 to grade 12. So definitely more prevalent, and because of the incidence of birth control amongst this population of women, there's definitely a deficit in reaching young men to be able to engage in the vaccination series.
So you're saying there's more opportunity in their practice to engage with women? Sorry.
Yeah, no, exactly. So when birth control is prescribed, often with that comes the opportunity for follow-up. So the consequent vaccinations that are required to complete the series is more like tangible for women. And now I'm not saying all women engage in using birth control. However, it does increase the prevalence of clinicians' conversations about preventative and safe sexual practices.
So what would your recommendations be in regards to what physician or clinician practice should be?
I think this is an interesting question because it comes down to what's actually feasible and what can be done with it in clinical practice. And I think an interesting population to involve regarding young men is their parents. And in making these conversations happen in the school setting, so where there's a family practice nurse or a physician present in the school setting. So making sure that this knowledge is translated, because as I mentioned in the poster, a lot of the beliefs kind of maintain that HPV is mainly a women's issue because it's related to cervical cancer. So kind of trying to change that narrative so that it can be more broadly publicized and hopefully influence pharmacists, oral health practitioners who see more of this population, hopefully be able to engage in this prevention more readily.
Yeah, and I also see a role for public health, especially in the context of the recent pandemic and their responsiveness when it comes to infectious disease. And years ago, when we were little, there was a public health nurse that came around to school. So I think that there's an opportunity here to look at also public health nursing in regards to, awareness. I mean, that's where I got all my vaccinations in high school, through school age and high school was the public health nurse came to inoculate. So yeah, because it sounds like the clinicians have, and I was also just wondering, when yeah, I wonder if there can be a prompt. Sometimes there's a lot of literature about, that prompt to do something and how it's a reminder. And I'll try to find the literature if I can. There's a specific term, I'm just drawing a blank, but it's like an intention. So if there's a way to even prompt them so that it's intentional practice for, any, you know, engagement with men in this age range to like prompt them to say that.
Exactly. And I think what's important to recognize is where policies and practices change so frequently. And this is a newer adaptation to the vaccine recommendation. It may not always be streamlined in clinical practice. So I think
Yeah.
that's a very helpful opportunity to have those helpful prompts that can really yield significant benefits from a cancer prevention perspective.
Well, an oral pharyngeal cancer is showing up more, and I mean, Lindsay can probably discuss this as well or talk to this, but it's identified sometimes quite later in life. And so I don't know if we're seeing increased incidence and rates of HPV and we're not doing anything about it in the population and it's going to be downstream that we see something. So I'm sorry, I'm asking too much. Go ahead, Lindsay.
No, that's great. Thank you, Noah. And you had already actually spoken to one of my questions, which was if you had to do this study again, and would there be additional clinicians that you would include? So very happy to hear the recognition of oral health professionals in that context. My question for you was actually related to in your abstract, you noted that there was a qualitative component of this research as well. And I don't see that reflected on your poster. So I'm just wondering if you can speak a little bit to the interviews that you also conducted with a subset of your sample.
Yeah, absolutely. So this was something I went back and forth about. And this was done at the undergraduate level. So this was kind of my first introduction to conducting a research study. And as we kind of were formulating a way to meaningfully evaluate the qualitative piece that was conducted, so there was 3 interviews conducted, we found it quite challenging to kind of take out themes because there was only 3 qualitative interviews. So for the purposes of this presentation, excuse me, I just got a tickle in my throat. Sorry about that. We ended up omitting it. And then what's going to take place is that we're going to kind of do some pertinent abstractation from the transcripts and apply it in the manuscript that's going to be submitted. So they're not completely forgotten about, but just for the purpose of this and how to meaningfully analyze it, we were going to do that in the last stage of kind of getting these findings out to practice.
Great, thank you. If I have time for one more little poke at that. No,
We're actually quite over
that's
time
okay.
now, so
That's
we'll
all
have to
right.
move along.
Thank you,
Sorry.
Noah.
Awesome. Thank you so much. Wonderful.
Great. And so now we have Brianna.
All right. Thank you very much. Thanks, Julie, for sharing the slides. And I'm thrilled to be able to present my doctoral research here in this format with all of you and get to learn from everybody. I'm taking notes as I'm going along. It's really great information that's being shared. So I'll begin my presentation. Today, I'm going to be speaking about Parenting Pain Away, an evaluation of an eHealth resource to determine acceptability, feasibility, and utilization of parent-led pain management. To situate the purpose of this work, we'll begin with the background. So all newborns regularly do receive painful procedures like intramuscular injections to ensure that they are and maintain healthiness. Still today, infants often do not receive pain management during procedures, which can affect how babies feel and react to later pain, impairments in their neural development, and altered behavior regulations, just to highlight a few points. There's widespread evidence that supporting parents' role in reducing their baby's pain during procedures through strategies like breastfeeding, yet there are barriers to parent-led pain management, actually being implemented into clinical practice. This can include parents' limited knowledge about these strategies and inconsistent engagement from healthcare providers. So this doctoral project sought to develop an accessible, comprehensive eHealth resource to evaluate parents' access to information and participation in procedural pain management, then to evaluate its impact when it was given during the prenatal period. So this project was conducted in phases to co-create Parenting Pain Away, targeting families on Prince Edward Island. Parenting Pain Away was formatted as a website, which was available 24/7 on whatever device users preferred. Parenting Pain Away is derivative work from a novel eHealth solution called ShaneNICU Home, which was led by my supervisor, Dr. Campbell Yo at IWK Health. So the original content for the infant pain was adapted to target low-risk childbearing families for this research. And then additionally, consultation with a key stakeholder committee was essential to inform the website development phase of this work. In phase 1, there was refinement of Parenting Pain Away, which was conducted through iterative cycles of usability testing with parents of newborns and expectant parents. Participants were directed to use a think aloud approach, where they verbalized what they saw and what they thought as they were navigating through the website. User satisfaction was measured using the post-study system usability questionnaire, and analysis of testing and sessions occurred in alignment with the ShaneNICU Home usability evaluation specific coding scheme, which was categorized the narrative feedback under 4 themes. In phase 2, we conducted a quasi-experimental study where low-risk expectant parents received access to the website prenatally. Then after birth, we evaluated if parents liked the website, if they found it was practical to use, and if parents had a greater knowledge of pain management, high confidence in parenting, and used parent-led pain management strategies during their newborn's procedures. Quantitative data were expressed through descriptive statistics, comparative analyses were performed, and the qualitative data were analyzed through content analysis. So for results in phase 1, we had a total of 10 participants complete 2 iterative cycles. The demographics were similar across the items measured. Mothers and fathers were included, and there was a mix of parents who were expecting and those who had had a newborn. Overall, we found that participants were generally satisfied with Parenting Pain Away, showing a greater satisfaction as the website evolved. Participants emphasized the importance of efficient information delivery to mitigate additional burden that parents experiencing mental fatigue already have. And they also championed this website as an eHealth resource that was accessible, inclusive, reliable, and contemporary. In phase 2, we had 41 participants complete all aspects of the study, and similar with phase 1, demographics were quite similar with this sample. And after having access to Parenting Pain Away, 23 participants deemed that it was relevant during pregnancy, noting that it supported their preparation. Participants scored the website above average as per the system usability scale when compared against benchmark standards. And overall, no analyses were statistically significant. So I'll just note that 26 participants were involved in pain management during either the vitamin K IM injection or the newborn metabolic screen, which is a heel lance. Both procedures occur within 24 hours of birth. And participants reported either using holding their infant cloth during the procedure, followed by skin-to-skin care where the baby would be unclothed, and breastfeeding and sucrose as pain management. We also asked if participants had any concerns about parent-led pain management, and 3 patterns emerged from what they shared, but for the purposes of this presentation, I'll just highlight the most substantive. So lack of support, which really reflects how participants felt their healthcare team did not engage them during procedures. Important to note, at the time of the study, there were no formal policies or practice directives in place at the provincial hospitals related to pain management. So to conclude, participants in this project appreciated accessible evidence-based health information and being involved in pain management. Parenting Pain Away does show potential to be an effective resource for families, but institutional commitment and healthcare provider support are really essential for practice change to include parent-led pain management procedures with infants. Thank you.
Thanks, Brianna. I'll let Lindsay go first.
Oh, wait a minute. I think I'm the other judge, right, Lindsay? Yeah.
Yes,
Oh,
it's
is it
actually
Megan?
Megan on
Sorry.
this one.
Okay, I'll just ask the first quick question then. Were you surprised at any of your outcomes?
To be honest, I thought that there would be a higher use of pain management, parent-led pain management. I did assume, because we were equipping them with lots of knowledge, and the website that we have developed was, we intentionally created it to include a sense of empowerment and really clear guidelines about the process of connecting with your healthcare provider in hospital. So typically the nurse, to be able to plan and prepare for being able to provide pain management for their babies once they were born. And I thought we did actually have a relatively high level of knowledge at baseline of pain management as well too. So kind of with that in consideration, their eagerness to be involved in the actual study and going through the website, I thought, we might see really high rates, but unfortunately that wasn't the case. But again, it was the reason why was pretty consistent to what was previously in the literature with sometimes healthcare providers may not facilitate or engage clients because maybe they feel like they're protecting the parent from seeing their baby in pain, or ergonomics in actually performing the tests. For example, that newborn metabolic screen, the blood draw is quite tricky to manipulate the baby's heel while they're skin to skin, although there's ways to do it. And just kind of a lack of the unit culture as well too. At that point, it was starting to become more and more, I guess, well-known and a part of that this is evidence-based practice and we should be completing it, but there was still some unit norms where, for instance, the vitamin K IM procedure would happen when the baby was on the warmer during their physical assessment and not when they were with their parents. So lots of learning and excited to move forward with it.
Thank you so much. Sherry.
Thank you.
Yeah, so in terms of moving forward with it, what are the next steps? What would you like to see?
I do see some value still in Parenting Pain Away. So I'd really love to I'm right now in the process of updating the website as it kind of fell a little bit stagnant while I was preparing thesis. So just to make sure that the most current evidence is incorporated in through the website. And then I want to collaborate with Health PEI, specifically the maternal child care, or the family newborn unit, as well as public health, to be able to just see what their needs might be, how we could improve from there. And then I would love to do maybe a mixed method study where I could introduce this website again prenatally and track even up to the first year of the baby's life to see if this was any impact in terms of parent-led pain management throughout their whole immunizations schedule in that first year.
Yeah. We have time for one more question.
Thank you.
Thanks, Brianna.
Thank you.
Anyone from the audience?
It was a lot to include in 5 minutes, so hopefully it wasn't
well done.
Yeah, thank you.
I don't see any hands going up. So, Okay, wonderful. Thank you so much.
Thank you.
And I believe we have one more presentation, right?
Yeah, it's Keisha. So there's your poster.
Okay, perfect. Thank you. So I will just go ahead and get started. Good afternoon, everyone. My name is Keisha Jeffries, and I am an assistant professor in the School of Nursing at Dalhousie. And I am very excited to share this poster on my emerging and innovative program of research, which is called Embrace. So my program of research, Embrace, was created as a continuation of my doctoral research, as well as years of community-oriented advocacy work. This includes my doctoral research, which involved a qualitative study that examined the leadership experiences of African Nova Scotian nurses, as well as the co-founding of the Community of Black Students in Nursing, which is a peer mentorship initiative, as well as task force work with organizations such as the Registered Nurses Association of Ontario and the Canadian Nurses Association, where we were working to address anti-Black racism in nursing. The acronym of Embrace stands for Multidisciplinary Black Research and Advocacy Center. And as you can see from the logo is quite colorful, and the colors represent the African Nova Scotian flag, where the Black represents the people, the red represents the sacrifice, the gold represents the cultural richness, and finally the green represents fertility and growth. Also, you can see that the infinity symbol is woven throughout the logo. Again, this illustrates the continuity as well as the interconnectedness of the research and advocacy and the work in general. Importantly, Embrace is guided by the theoretical tenets of Black feminist theory, which is a critical social perspective that centers the ideas, experiences, voices, as well as interpretations of Black women, while also examining how social, structural, institutional, as well as systemic factors impact experiences. Embrace was designed with a specific vision in mind, and this was to be a multidisciplinary center for robust, comprehensive, as well as high-quality research, as well as culturally conscious knowledge mobilization, as finally to advocate for Black population health. Excuse me. As you can see, the mission of Embrace is to synthesize and to generate evidence, develop evidence-informed frameworks, and then to implement evidence-informed initiatives to advance the health of Black populations. And so to achieve the vision and mission, I created 4 overarching objectives for Embrace. These include the systematic synthesis of evidence, conducting primary research using both qualitative as well as mixed method study designs, and using a combination of more traditional scientific methods paired with critical social methodologies, developing evidence-informed frameworks to guide practice, and then finally implementing and evaluating evidence-informed interventions, initiatives, and programs. Embrace includes 2 central components, as shown on the poster, which are research foci and mentorship. In terms of research foci, the first is Black population health, which aims to examine and describe the factors that influence chronic health conditions for Black populations. I currently have 2 active projects. One is a qualitative study, which is funded by Research Nova Scotia, and this is focused on understanding the experiences of people of African descent with uterine fibroids in Nova Scotia. And the second project includes a scoping review of literature related to Black people of African descent with uterine fibroids globally. The second focus is inclusivity in nursing, and this builds directly upon my doctoral research and advocacy, and it aims to address anti-Black racism in nursing education and practice. The current project within this focus is the Belonging and Success for Black Nursing Students in Nova Scotia project, and this project has 2 branches, which includes one program initiative termed the Pamoja Nursing Program, as well as a mixed method study that will examine the experiences of Black nursing students in Nova Scotia. The second component is mentorship. And so mentorship is a critical component of Embrace, and I hope to facilitate the recruitment and retention of Black students, health researchers, as well as the future generation of critical health leaders in nursing, as well as in allied health programs through the undergraduate up to the postdoctoral level. Through various program initiatives, I see Embrace as being an an important entry point and pathway for recruiting and training aspiring Black health researchers and trainees in both Nova Scotia and across Canada. For example, as you can see on the slide, I host a weekly Embrace Ideas Research Hub meeting, and this is essentially a space where we can connect, where students and trainees are able to meet, explore, and discuss research ideas. Additional program activities are really designed to encourage and support research assistantships and to allow students to develop skills in community-oriented research as well as Black health research. And that concludes my presentation. Thank you for tuning in.
Thank you, Keisha. Over to the judges.
Go ahead, Lindsay. Thanks, Keisha.
Keisha, thank you so much. There's so much to take in there, and it's such exciting work that you're doing. I have so many questions that I'm going to try to temper myself.
Yes.
So one of them I'm hoping you can speak to a little bit more. I mean, we're talking about examining chronic health issues affecting Black communities as one of your research foci. And you mentioned a little bit expanding those mentorship opportunities to not just, I know you have such a nursing foci and that's where you come from, but can you talk a bit about what you foresee or envision for kind of possibly expanding beyond that to include other health professions?
Sorry, Lindsay, what was your question again? So in terms of expanding beyond nursing or beyond the chronic health conditions, just to clarify.
Yeah, so looking at expanding beyond, kind of within the mentorship program, like obviously looking at attracting and retaining individuals to health sectors. And I know you have a really nursing focus. I'm wondering how you foresee possibly integrating more health professions in this center.
Oh, very nice question. Thank you for asking that. And so again, coming back to, the acronym EMBRACE. So I'm really hoping that this will transform into a multidisciplinary center or research hub. And so that would include recruiting from health professions, but also outside of health realms. And so that would be done currently, for example, with the University Student Research Awards. I'm working with a lovely student who's on the call, who is a medical science student. So looking at different opportunities for recruiting undergraduate students from outside of health and also specifically outside of nursing, because again, a lot of the issues, and so when we think about chronic health and just health in general, we know that it's not siloed to nursing or even the health field. There are a lot of factors that actually impact health. So that's why we need this very multidisciplinary or even an interdisciplinary approach to tackling these questions. And so the Embrace is not limited to nursing. It has a much broader vision, I would say, but it is focused on addressing the historic and ongoing anti-Black racism within nursing education and practice. So there's almost two parallels happening there. And in terms of, I guess, addressing the larger issues of anti-Black racism in health, that is also an element that we will be working on in terms of collaborative projects with co-investigators, but Embrace focus exclusively on inclusivity within nursing, but then also addressing multidisciplinary focused health conditions. Does that answer your question?
It does. Thank you so much. That provides some excellent context. Yeah.
Great.
Maybe I'll pass it over to Sherry next.
Thanks, Keisha. Wonderful presentation, beautiful poster. Yeah, I mean, similar to Lindsay, I was thinking about the interprofessional piece, and also I think it's more of a comment than it is a question, but I think that your work is also really important in the context of some other initiatives across the tri-faculties, because I think this is a shared issue. And when we do a lot of our interprofessional education initiatives, we've tried to address the issue of equity, diversity, inclusion, accessibility, and anti-racism. And yet I think that the work that comes out of this project and Embrace could really help inform that. So I think that building those connections interprofessionally and working interprofessionally are really key. Yeah. Great job.
Thank you for that comment, Sherry. And that's one of the, I guess, exciting pieces I think about is for Embrace is that it just is very well situated at Dalhousie, which is why I was just very obviously excited to come back as well, right? So I do feel as though it plugs in nicely to, I guess, the direction of the school, but then as you mentioned, with the faculty and the university in general, but then also thinking provincially. So I do think it is like well situated, and it's still in its early stages. We're growing and building, but that is the vision, to impact policy changes for sure, related to health, but then also education. Mhm.
Thanks, Keisha. Thanks very much. Anyone else have any questions for Keisha?
Yep. Anybody from the audience?
I can ask one really quickly.
Thank you.
You mentioned you're having some of these like engagement sessions with students and trainees. How has the turnout been for those? That's such a lovely idea, and how to get people involved with your lab. So how has that been going for you?
Right. Well, I would say it is going quite lovely, actually. They're all on the call, so they're all currently in G38 right now. So shout out to the team. Thanks for joining. But it's been going well. So we have had other students who have been dropping in. So again, I mentioned medical science. I'm not sure what's going on with medical science, but there are quite a few medical science students who have been joining, which is very exciting. So there's that piece. And then there's also undergraduate nursing students who are attending. And so I guess what I'm trying to do is grow it, but not too quickly. So not advertising too much, because again, it's a learning process for me as well. And, the team is extremely patient with me, so I appreciate that. So to answer your question, Noah, the turnout has been great. Again, we have the weekly ideas meeting, but then we also have our regular meetings with our project teams, and, always a great turnout. And I can really see the mentorship building. So it's mutual mentorship as well. So I'm learning so much from the team, and that's reciprocated. So it's just been going very well. I have to say thank you.
Lovely. I'm so happy to hear that.
Great. Okay, well, our time is up for all our presenters. So I would just like to thank everyone, all of our amazing presenters, and just wonderful work. I'm just always so impressed with the scholarship that we have across our Faculty of Health and Medicine and Dentistry. So that concludes our time today, and the judges will be going away and we'll be tabulating our scores, and we will let you know the outcome of that probably fairly soon, in the next day or two, and Julie will help us with that. Any last comments from anyone?
Just great to see everybody.
Yes.
It is. Absolutely.
So nice to see everyone. Thanks for having this, hosting this. Yeah.
Yes. And thank you to all of our audience for participating. And again, we can rewatch or share it so that others can benefit from all of the presentations. Great. Okay, well, take care, everyone. Have a
Megan,
wonderful
are we
rest of
going to
the
stay
day.
on? You and I, and are we staying
Yeah,
on?
we can.
And
Yeah,
we can
we will
start
wait.
recording.